Thanks very much for the kind invitation to speak, and this afternoon I'm here representing the Paramedicine Board of Australia as Chair, and I'd also like to acknowledge a fellow board member that's here for this event, Miss Claire Beach from New South Wales, who I'm sure will be around this evening. It would be remiss of me not to start by recognising and thanking the members of the jurisdictional ambulance services, the professional associations, Paramedics Australasia, Council of Ambulance Authorities and the Australian College of Ambulance Paramedics of New Zealand for the effort that they've been making in moving in a forward direction, and the contribution that's been forthcoming in getting the paramedics in Australia ready for regulation later this year. That aside, I'm going to talk on two key points. The first one is about paramedicine as a profession, with a particular focus on Australia, but I'm sure you'll see there's application more broadly. And the second point about what regulation and registration actually mean. So if we think about paramedicine as a profession, what are we actually talking about? And there's lots of narrative around about what it means to be a professional. If we think about the words that are commonly associated with being a professional, we hear words like integrity, teamwork, respect, reliability, community, honesty, quality, etc., etc. But this has been an evolutionary journey for the profession, starting from very, very humble beginnings. And I look back here in 1892, where the first focus seemed to be on ambulance transport in the early war period and the post-war period, to later some of the development of social services in Australia post-Second World War. But in the beginning, as a profession, we did things a little differently. We used some very, very basic things, and I'm sure there's people in the room that have been around a while that will recognise some of this equipment. We had everything from the famous St John's First Aid book to the ambulance blankets to things like shell dressings and field dressings coming out of the Second World War. And if anything really needed to be fixed, you could always rely on mercurochrome to do it. We moved on a little bit from there, and we started to become a little more sophisticated, and we looked at how we would actually move these patients, and we moved from having litters, we moved from having stretchers that were basically gurneys on the ground, thinking about how we could put an undercarriage on them, and had some very, very basic stretchers and carry chairs to start with. Our equipment, and again, some of you will recognise some of these things, started to get a bit more sophisticated in the 70s, 80s, early 90s, and we started with some defibrillation. The old stalwart there for most ambulance services in Australia, the Life Pack 5, and people like me, and how many others in the room remember the Life Pack 5? I mean, you could drop it out of a helicopter and it'd still work. Everyone wanted a new defibrillator, so we ended up with those Hewlett-Packards, affectionately named the boat anchors. Very, very good defibrillator, but awfully big. And some of the Zols that entered the market, but we ended up with traction splints, pneumatic splints, air splints, vacuum splints, Kendrick extrication devices, Russell extrication devices, and the list goes on. The famous Oxyviva, and in the mid-70s we were allowed to have sphygmos, and we started to be allowed to use stethoscopes. Now for people who are new generation graduates, they'd find that a real mystery. That's something that they've always seen in practice since they've been studying paramedicine. For those who recognise the Camisarov used by the ACT and the Victorian Ambulance Service for quite an extensive period. Mask suits and gladiator suits. We had spine boards, Jordan frames and other lifting devices. But what really was the change in practice? What really made the difference? We moved from a non-invasive care and transport model for our patients to something that was evolving, something that was different, and we built that on the basis of trust that was in the foundation of the health practice of the paramedic. We started to use scheduled medicines. We were allowed to use scheduled medicines, and it all had its genesis with things like anginine and Ventolin. Pretty low level to start with. but it's quite different in the context of the practice that's available now, and here's just a sample of some of the scheduled medications that paramedics are trusted to use. We've also got the technology overlay, and this is actually an intensive care, critical care transport for the military, and if you look very closely you can see the patient's head and you can see the patient's feet there, and there's actually a technician on the other side that you can see in the middle with their hands exposed, that's looking after that patient. So our environments have changed. It's gone from non-invasive to invasive care and treatment. We're using scheduled medications and we're using a host of technology. That's caused a change in practice and increased the practice risk. We're now talking about paramedicine as a profession. What are the key elements of a profession? There are three mainstays. One, a profession has a body of knowledge that's specific to the practice in the profession. Secondly, there's specific capabilities required from the people who practice in the profession. And thirdly, the education and training in the profession to achieve the qualifications are underpinned by specific accreditation requirements for those qualifications. More importantly, and the emphasis is that the people in the practice, in the profession, actually make the profession. It's not something outside, it's not rules that are bound or made by managers, it's not rules that are bound and made by associations or anyone else. It's actually the people within the profession that actually make the profession. So then, where does that bring us to? Paramedicine as a profession is the members demonstrating professionalism in their practice. And it's kind of nice to be at this conference with this conference theme, because in my mind, the other underpinning value in a profession such as paramedicine is the patient is at everything that we do. So we've got a profession. We're able to mark that out. We're able to demonstrate those three elements pretty clearly to people who look at paramedics and what they do. We've now entered into a regulatory frame. And for those who've been around in the industry for a while, and some in the room I recognise, 3 and 4 decades in the room, when I joined in the late 70s in ambulance service in New South Wales, they said, don't worry, in a couple of years we'll be registered like nurses. Okay. It's taken that journey to now for the change in practice, the way paramedics are trusted, to actually have governments take on board the need to register the profession. And in the registration of the profession, those who understand regulatory models and their application, the only reason that you actually regulate is because governments consider that there's a practice risk by the people who are providing services within the profession. So regulation is based on public safety. It's based on risk to the public. Government's decided that the risk of practice in the profession is such that the government needs to regulate to ensure public safety, to ensure competence and ethical practice by people who are in the profession. Secondly, it's underpinned by national law. And it's interesting, just to be clear, the national law isn't Commonwealth law. It's actually adopted laws legislation or an adopted laws model, and in a federation model such as Australia, one state or territory holds the parent legislation, and after that process goes through, after the legislation moves through the legislative process in that particular state or territory, it's adopted in its form in every other state and territory. In this case, Queensland holds the parent legislation, which has in turn been adopted by every other state and territory to form the national law. The third component of it, after we have the national law, which establishes the thing in the middle, which is the National Registration Accreditation Scheme, the law also provides for the establishment of a statutory body for the profession, and that's the Paramedicine Board of Australia. The other statutory body that operates under the model is the Australian Health Practitioner Regulation Agency, and they provide the shared services in support of the operation of all the professional boards in Australia. So, this issue of practice risk to the community, to even get considered, to even be considered to become a regulated profession in Australia, you need to be assessed against 13 risk criteria. And when paramedicine was assessed approximately 3 years ago against those 13 risk criteria, it was established that paramedicine at that time met or had more or exceeded more risk factors than 10 of the already registered health professions in Australia, and that's not surprising. So what are national boards and AHPRA responsible for? National boards are responsible for setting professional standards, for the registration of practitioners within the profession, for the management of notifications against health practitioners within the profession, and it's an interesting term that's used in the legislation nationally, but notification is where someone makes a notification against the practice of the professional, and then someone will interpret it through a triage model to determine whether it is in fact a complaint, and that complaint is worthy of investigation and further actions. It's also responsible for appointing an accreditation body that accredits the education that underpins the qualifications for practice in the profession. We're lucky to have a 9-member board that was appointed by the Council of Australian Government's Health Council. Each of the people that are on the screen there represent a statutory appointment to the board. There are 9 members, 3 of whom are community members for their community contribution and professional experience to the board. The 6 remaining members are practitioner members from the major states and territories, and the smaller states, smaller state and territory, that is Tasmania, the ACT and the Northern Territory, have 1 practitioner representative. The scheme's rather large. Just recently in Australia they registered the 700,000th health practitioner in Australia, and for those who like to actually compare that to something that has meaning, if you look at the ABS data, there's approximately 12 million people out of the 25 million people in Australia that actually work. 8 million of those people work full time. When you work the math, about 1 in 18 people in Australia is a registered health professional. There's 15 health professions, which includes paramedicine. There'll be 30,000 more health graduates this year in Australia entering the health professions, and we estimate that there'll be 15,000 paramedics that'll be eligible to register later this year. The date that the board's working towards for the commencement day is the 1st of December 2018. A little bit more. Again, lots of questions often get raised around this particular element. It's actually in every profession in Australia, it's protection of title legislation. It's not about scope of practice within the professions. And that doesn't change in any of the other professions. And whether you're talking about medical practice, being a dental practitioner, a psychologist, a physiotherapist, an osteopath, it's all about who is entitled to call themselves a paramedic or one of the other professional titles that's protected. It can only be used by people who claim to be qualified to practice as a paramedic and people who hold themselves out to be a paramedic. And in this case, it's actually an offence against the law to do any of those things if, in fact, you're not qualified, competent and a suitable person to be registered in the profession. The professional standards across the 15 professions in Australia is underpinned by registration standards. There's 5 enduring standards and they're consistent with all the other professions. They were approved for paramedicine by the Ministerial Council on the 13th of April this year, and there's a 6th standard which is a time-limited standard for grandparenting, and I'll discuss each of these very briefly. These are the common questions that are often raised in discussions or at forums about the 5 standards. In terms of the criminal history standard, the people who are applying for registration once the scheme opens need to make a declaration within their application of all convictions, including spent convictions in Australia or internationally. The importance and the emphasis that I make here, it is a second stage process to determine whether the offences are material to the practice of that health practitioner currently and whether they present a safety risk to the community or not. But if people have got convictions and they don't declare them, that gives rise to a whole lot of other questions within the scheme about whether the person should be registered. The standard describes what criminal history is, including whether the matters required to be declared are relevant to practice. And again, some examples on the bottom there about the specific sorts of things that the regulatory operations people look at, the nature and gravity of the offence, the period of time since the offence was committed, and the likelihood of future threats to patients or public safety as a result of those matters. In Australia, every person's got to be able to communicate effectively in English, so the English standard applies. In most cases, if you come from an English-speaking country, as determined by the Department of Foreign Affairs, and you've undertaken your primary and secondary education in English, then you're okay for the English language standard. It also goes on to say if you've undertaken your higher education in a country, in a university, and you've undertaken those studies in English, then you've got no issue with that. However, if you have done your studies in another country, an overseas non-English speaking country, then you could be required to undertake an occupational English test, which is used to establish your bona fides to be able to communicate effectively in English. Quite often doesn't present a lot of problems for most people, but there are some people working in Australia that will have to do the English language test. Another one that often gets a bit of airplay is the professional indemnity insurance required as a health practitioner in Australia. The APRA website's got a section on frequently asked questions, particularly on this subject, that apply across all professions, but if you distill that down, professional indemnity insurance is required for anyone who's a health practitioner in Australia. The level and extent of the insurance that requires depends on a number of factors, and it's variable to the individual according to where they practice, the type of practice, etc. The 3 key considerations about the level of cover are whether you're employed, whether you're volunteering your services as a paramedic, or whether you're self-employed. Now, for most people who work for jurisdictional ambulance services, there'll be a level of either statutory indemnity because of the legislation that's provided for the operations of ambulance services. And again, this is variable because it's not the same in every state and territory. All employers for the major ambulance services, however, will have some sort of vicarious liability insurance for the practice of their employees within the state and territory, which would need to be considered. And as I said, for the others, there's other context that they would need to think about. If you're volunteering, and again, if you're doing anything that would be considered to be holding yourself out to be practising as a paramedicine, then you need to have PII. In the examples of volunteering, if you're working for the local football club and you'll say, I'll be the paramedic that's available on the weekend, then you need to check with the local football club to see if they've got PII for your practice, and if they haven't and you still want to volunteer your services, then you need to make sure that you've got PII. The third one is obvious. If you're self-employed, you need to have your own PII. The last point on there is the clear point that's made several times throughout the standard, and is the onus of responsibility is on the individual to determine the PII requirements for their need. In Australia, most of the unions have extended PII coverage for members of unions. The professional associations have negotiated rates with major insurers in Australia. Paramedics Australasia, for example, has negotiated with Guild Insurance to provide PII for paramedics who wish to take that offer up. The next standard is continuing professional development. It really means that people need to maintain some contemporary knowledge of the practice in the profession. The standard's decided on 30 hours per year for CPD, largely based on nursing and some of the other professions in coming up to those hours. In Australia, a nurse, a midwife or a nurse practitioner is required to undertake 20 hours of CPD each year. However, if they've got scheduled medicines or endorsement, they're required to undertake another 10 hours. So in the case of paramedics, considering the scope of practice, 30 hours was the amount of CPD that was determined. The other caveat in there is that 8 of those 30 hours a year needs to be in an interactive environment. In other words, you need to be doing something that is with other health professionals that relates to the practice in the profession. There's a guide that goes with that that expresses those requirements in more detail, as well as the requirements for record keeping, etc. This is a particularly important area because this is where people are expected to use reflective practice, and this is just one of the models of reflective practice that are commonly used from Driscoll in 2000. But it's really looking at, when you're talking about the practice in any of the professions, about what happened, what did the experience actually mean to me, and what are the next steps in the context of thinking about what happened and what did the experience mean to me that would actually improve my practice. They use this process of 3 or triple loop learning. First loop learning is just looking at results and the actions that you took to get the results, and the question that arises from that is, in terms of professional health practice, is are we doing the right things? A lot of people talk about double loop learning, and then you look at the assumptions that guided your actions that produced the result. And in that case, the question that's asked is, are we doing the right things? When you actually take it to the third level, the triple loop learning, that's about looking at the context in which the assumptions were made that led to the actions that produced the result. And the question that arises in the context in the triple loop is how you actually decided to do what is right. In summary, reflective practice is really about a person looking at their practice in retrospect and looking at the way they did things, trying to understand the theories of change and change in practice that help guide improvements in practice, and importantly, that they're not afraid to challenge the assumptions that are there for both themselves and other people around the practice within their profession. The next standard is the Recency of Practice. This is pretty straightforward. Every year on application and at renewal for registration, a paramedic will be required to declare that they've had 750 hours practice at least in the previous 5 years, with a gap of not greater than 2, or 450 hours practice in the previous 3 years, or 150 hours practice in the previous 12 months. They're not overly onerous, they're consistent with the other professions, and they're part of the registration standard, which means they're part of the national law. The other thing that people get hooked up on or caught up on is this definition of practice. Within each of the professions, practice uses a common definition, and it says that it's based on practice in the profession, whether you're remunerated or not, in which the individual uses their skills and knowledge as a health practitioner in the profession. But what's also important, it's not restricted to direct clinical care, and it can include all of these other areas of practice within the profession. So within practice, there are various domains. There's obviously a clinical practice domain, and people need to be competent in their clinical practice. But in these other areas, such as management, such as administration, in educational roles, in the definition of practice that's used for paramedics in those environments, they also need to be competent in those roles. Now, this is the tough one, the grandparenting one. Everything in the profession's easy in terms of the decision to go forward in the profession, because there's an approved set of qualifications for people who are new entries to the profession. There's a list of standards that they're required to meet to be able to enter the profession. The grandparenting provision is all about dealing with up to 40 years of the past and practitioners who are still practising as paramedics who've been in the system for up to 40 years. So the grandparenting provision is a time-limited provision. It's available for 3 years only. There's a 90-day window at the beginning of it, which starts at the commencement of the registration for paramedics on the commencement day, in which people who are past practising paramedics or paramedics who don't hold an approved qualification can apply under one of 3 pathways to be registered as a paramedic. The focus in the grandparenting pathway is on the qualifications and the practice competence of the practitioner, and remembering when we say practice competence, we're not talking about scope, we're talking about practice competence within the definition used across all of the 14 health professions. And notwithstanding the qualifications and competence, the applicant must also meet all the other standards that have been set. There's also an interim code of conduct that applies to paramedics. It's equivalent to the code of conduct that's used across the other professions. The key elements in there are about the conduct of the practitioner, the performance of the practitioner, in other words, the skills that they're using within the practice environment, and the health of the practitioner. And again, that covers areas such as impairment and fitness to practice. There's guidelines for mandatory notifications, and these apply commonly with all other professions. If you are practising or you observe someone practising who has issue with their conduct, their performance or health, under the national law there are mandatory requirements for you to notify the regulation authority about that practitioner. When we talk about notifications in the system, as I said, 700,000th registered health professional recently in Australia under the scheme, but in the last annual report for the scheme there were 680,000 professionals in the scheme. And in terms of the complaints within the system against that 680,000 professionals, the rate was reasonably low. There are only 10,500 complaints made across the system for the 680,000 professionals. Unfortunately, fortunately for some of the professions, unfortunately for medical practice, 50% of those 10,500 complaints were actually in the medical practice area. If you look a little bit further down, there's also some information on there that nearly 71,000 criminal history and international criminal history checks were undertaken within that period as well. The 3 main reasons for notifications being made against the practitioners that had notifications made against them were for clinical care, in the middle for pharmacy and medication issues, and the other one, 8.4% of them were about health impairment issues for the practitioners within those professions. We've also posted on the website the professional capabilities for registered paramedics on an interim basis. We're proposing to go to consultation nationally next year as part of the requirements under the national law to confirm these capabilities for the profession, and they'll be used to in situations such as doing an assessment or examination of a professional that needs to be reassessed for their competency. So, the simple model that appears on the Australian website for Australian paramedics, it boils down to 2 key areas. The first one, as we've gone through, is are you qualified to be a paramedic? Qualification is in terms of having an approved qualification, and an approved qualification is a qualification that's currently being taught by a university higher education provider in Australia that is currently subject to the accreditation arrangements by the Council of Ambulance Authorities, and that'll continue up until the commencement date. The second entry pathway for a qualification there is to have an accepted qualification. There's only one accepted qualification under the national law, and that's the diploma or advanced diploma issued by the Ambulance Service New South Wales, when the paramedic within that service reaches a stage where the ambulance service deems that they're actually qualified to practice as a paramedic within their system. Underneath that, this is where the grandparenting pathways kick in. And again, this is about being qualified and competent. Within the adequate qualification arrangements, there's a list of past qualifications that are issued or have been issued by higher education providers. In Australia, that's AQF 7 or above, but it could be a qualification in paramedicine that was previously taught that's been replaced with an updated qualification, course code or course name. They'll be listed as adequate qualifications. The second pathway that'll be on the application form is being able to demonstrate and declare and demonstrate that you've had 5 years acceptable practice in paramedicine in the last 10 years. And the third pathway is that you hold a qualification and have completed further study and or supervised practice as required by the Paramedicine Board. So I guess in trying to understand the entry pathways, in talking to a lot of groups, it's really about taking the first part, it's about the qualification and competence, and using the currently approved qualification or accepted qualification pathway and being able to demonstrate that you have approved or accepted qualification, or for the grandparenting window, being able to demonstrate that you're qualified and competent using one of the 3 pathways that are available under that standard. The second side of the page is pretty straightforward. That's all about being a suitable person. And that means that the person applying can't have an impairment, has no criminal history, no outstanding regulatory issues. They're deemed to be a fit and proper person, competent to practice safely, and they satisfy all of the other Paramedicine Board of Australia registration standards. There's a brochure that's coming out very soon, a guide to the registration process. And again, this is unpacking those grandparenting pathways. You can see on the far right, there's some examples. If you're going down pathway 3, which is competent to practice, mainly around how long you've been practicing in the profession, some of the things that you can use to evidence your practice competence to the satisfaction of the board. And finally, this is the example of the publication that is being distributed to jurisdictional ambulance services, defence forces and other folk within Australia currently. Simply sets out how to apply for registration in advance of the date. My public announcement to get everyone G'd up and the launch, on the 3rd of September, the board's taken the decision to open the national scheme to accept applications for paramedics for registration in advance of the announcement of the commencement date, which the board's working on to be the 1st of December in 2018. I need to actually put the caveat on that the confirmation of that is a matter for the health ministers in Australia. They need to form a regulation when they meet in committee and advise the parliaments in Australia that the regulation has been made and the regulation has actually commenced for paramedicine. And we're there. Need to sign up for updates, need to sign up for further information. That's what you do. Real-time updates are advised if you subscribe to the e-news process. Thank you very much for the opportunity to speak to you.